Welcome to the Vanderbilt Online Guide for Children's Health. The following podcast is an interview with Dr. Rebecca Johns-Womack, Executive Director of the Office of Coordinated School Health for the Tennessee Department of Education. This interview will serve as an introduction to coordinated school health and go into great detail about the program efforts being implemented statewide through coordinated school health programming. The interview is being conducted by Healthy Children intern Carlin Rosenblum of the Vanderbilt Children's Health Improvement and Prevention Department for the Monroe Carroll Jr. Children's Hospital at Vanderbilt.
Great. All right. So first, just to give sort of a brief overview of coordinated school health, why is coordinated school health a mandate in Tennessee?
We are very fortunate to have our state legislators have the foresight and the vision and the love of children to create the coordinated school health law. It's a bipartisan law, meaning it doesn't mean that it's Democratic or Republican. It was created truly with children first and foremost at the center. And it is a mandate to, hopefully, our goal is to reduce childhood obesity and connect health and academics, because the bottom line is, and this is non-negotiable, it's non-argumentative, that a healthy child does better academically and healthy children go up to become healthy adults. So it's truly an investment in the future in the state of Tennessee.
Great. So how is coordinated school health currently being implemented in the state of Tennessee?
The model is the coordinated school health model that was developed by the Center for Disease Control and Prevention in 1987 by Lloyd Colby and Diane Allensworth, and it's evidence-based, research-based model, again developed by the CDC. And how it is distinctive and unique to Tennessee is that, first of all, we're the only state in the entire nation that has coordinated school health as a mandate. We have $15 million that provides just the basic infrastructure. We're housed in the Tennessee Department of Education, which is a perfect place for coordinated school health. And what makes it really unique, what part of the infrastructure that is absolutely imperative and what makes it successful in Tennessee, where other states have struggled, is having the basic infrastructure, the $15 million, fund a coordinator in every single school system. So every single school system in the state of Tennessee has a coordinated school health coordinator, and they are key to the success of the model and the coordinated school health mandate.
So in discussing these coordinators as being a key, part of coordinated school health, do you have any suggestions for individual schools or maybe like leaders within a school that want to become more involved in coordinated school health, of ways they can really reach out and utilize these coordinators?
Absolutely. That's what they do, is that they coordinate. So the coordinated school health model, as you all know, is an 8-component model. And it is the coordinator that coordinates all 8 of those components in the school and in the community. So there's there's endless opportunities for community partners, for agencies, organizations, people to get involved with the schools and truly make a difference in with Tennessee children and then eventually with Tennessee adults. We have an average, each school system has an average right now of 39 to 40 community partners. And that's what's so wonderful, is that you have the coordinator who measures through healthy school teams the strengths and weaknesses of the schools and then works to combat those weaknesses. And we find that so many community partners and organizations, they all have the same goal. And so many people truly want to make kids healthier. They want to reduce our childhood obesity rate. And what Coordinated School Health does is that coordinator brings everybody to the table. So everybody truly is working together more efficiently, combining their resources, and there's power in that. And that's how we see change truly occur.
Great. So what sort of successes have you seen so far in terms of the coordinated school health programming that you've implemented in Tennessee?
You know, it's these successes that truly keep me coming to work every single day. And I am an educator by heart. I'm a former PE lifetime wellness teacher, and it's truly seeing those weaknesses when I was teaching that are being overcome through coordinated school health that truly is absolutely phenomenal. Having that coordinator in place, like I mentioned, that the state dollars, $15 million goes just for the basic infrastructure. Well, having that coordinator in place, part of his and her role is to bring in grants, in-kind resources, different funding sources. And last year, our coordinators brought in, since the beginning of Coordinated School Health, we totaled it up, and they brought in over $73 million of funds that would not have been brought in funds and in-kind gifts if that coordinator hadn't been in place. And those funds go directly into the schools, directly to impact the school children. One of the beauties, or one of the beauty points of having a coordinator in their place is that, many states have different policies, mandates, and we're not different than any other state. We have a vending law. We have a physical activity law that mandates 90 minutes of physical activity per week for every school child, K through 12. Well, you can have laws and policies all day long, but again, what makes Tennessee successful is that coordinator helps making sure that the vending machines move towards healthier choices, making sure that the nutrition laws and policies are followed, making sure that physical activity law is followed. And when you look at the national data, through the CDC, we participate in the YRBS survey, and statewide, before coordinated school health in 2005, only 33.7% of our high school students were physically active more than 5 days a week. Well, now in 2011, 47.2 are physically active. So we're seeing success there. That is an increase. We are seeing kids that are more physically active. With coordinated school health, we collect an amazing amount of data, and we oversee health screenings and work with school nurses and school health services in the schools. And last year, we did over 1.5 million student health screenings. And out of that, over 225,000 kids were referred to healthcare providers for follow-ups. And that's what's so wonderful, is that it's not the coordinator doing it all. It's the coordinator working with school nurses. We love school nurses. We love school counselors. We love physical education teachers, and it's the coordinator really helping them get the support and the need that they need to do their jobs. Two parts of coordinated school health, which is amazing successes, that when the infrastructure was put in place and the law was put into place that we did not count on. Number one is food backpack programs. Right now, over half of our school districts have food backpack programs where children are sent home with healthy foods and backpacks who would not have any food at all over the weekend. Another success that we've seen that was not an intent in the basic infrastructure of coordinated school health, but is amazing, is is school-based health clinics, and we have seen an amazing increase in school health clinics as well. So again, these are successes that have just emerged from coordinators and different community partners seeing a need in school districts.
Great. So you just discussed some of the successes that you've seen, but can you maybe briefly discuss some of the barriers that you have encountered along the way and what may make things difficult for schools to properly implement coordinated school health programming?
The barriers are just like with anything else. This was new for everybody when the law went into effect in 2006. And so, part of the barriers have been, definitely how do you provide the technical assistance needed to all the coordinators and the Office of Coordinated School Health and the Tennessee Department of Education. We work really, really hard with trying to connect the community partners like Vanderbilt, like the Tennessee Obesity Task Force, all the different community partners to really help give the professional development and help our coordinators with their resources. Like with everything else, there's the coordinators have to work really hard with helping the teachers see and the administrators see what we do is not something extra, but an added bonus and benefit. And we know that all teachers are under a lot of stress across the nation for students to do well academically, and so it's just having the coordinators continue to be able to speak to people, to tell people what they do, to actually help reduce the burden and help increase academics, because we know that there is a strong correlation, and research shows this, between a child's health and their academic performance. So the barriers are just like the barriers you see with pretty much everything else, and it's just up to us to work together as a family team here at the Office of Coordinated School Health and pull together the wonderful community partners to help reduce those barriers.
Great. So you mentioned some of the funding that is available for the coordinated school health programming on a whole, but can you maybe discuss maybe some possible funding ideas for individual schools in terms of them being able to implement programs in their school?
Yes, the funding sources, again, are absolutely endless. Like we talked about, the state funding is just the infrastructure, but it's the coordinators that work with the healthy school teams. The healthy school teams assess the strengths and weaknesses through the School Health Index. That's the CDC's assessment tool. And they look at the weaknesses, and we see that the healthy school team then works with the coordinators to write grants. I'll receive grant information from the Tennessee Obesity Task Force. I receive national grant notices, and with one click of a button, we're able to send those out to the coordinators so they can begin working on those. It's also the coordinators that look at the strengths and weaknesses and then go to their own community partner and resources for help into the schools. And again, that's what's wonderful, is that there's not a cookie cutter approach. There's not a perfect approach to coordinating school health in every school district, because every school district's different, just like every child's different. You can't just teach to a body sitting in a chair. You've got to teach to that child, and that's where the coordinator is hired by the school district. So the coordinator works with the school district, works with the community partners, works with the parents to truly create the best healthy environment for the children in that county. And that's what's wonderful, is it looks different. Coordinated school health looks different in every single county based on the needs.
Great. So you mentioned that the Healthy School Team is really central to creating this coordinated school health programming in each individual school. Who really needs to be involved on those healthy school teams, and how do you, rally support behind the creation of those teams?
That's an excellent question. Healthy school teams, they are instrumental, and it's imperative. that people work with their schools, keep these healthy school teams sustainable, keep them going. It's not just another meeting. It's not just another team that doesn't get things done. A healthy school team is truly an avenue to truly overcome barriers in a school system. So what we ask is that healthy school team be comprised of a representative from all 8 components of the coordinated school health model. So that means a parent needs to be on that healthy school team. A community partner needs to be on that healthy school team. We ask that a student be on that healthy school team so you can get a student perspective. So it's truly a holistic team that, again, discusses strengths and weaknesses of the school and works together to overcome them. But I definitely encourage parents, community partners to get involved with their healthy school teams. It's a very invaluable part of the coordinated school health infrastructure.
So what are your hopes for the future of coordinated school health programming?
My hopes for coordinated school health is obviously just, the obvious is that it continue, but that it grow like never before. And truly, the more people we reach and we talk about and how this is truly a way to change the future of our state. I believe that it is. It's a wonderful link for children to do better academically, because we all know that a child that is socially, emotionally, and physically not ready to learn can't, and coordinated school health works on those barriers. I believe that it is truly a way to solve our obesity problem in the state of Tennessee, other health conditions, because it brings everybody to the table with the child at the center of the model, and that's what's important. I hope we sit here 5 years from now, and when we're talking about the successes, that it's triple $70 million. That instead of there being a 50% of increase in school-based health clinics, that we see that that through the roof, so that all of our successes continue. And that the funding is more than $15 million, that we have 2-3 coordinators in every single school district. But again, it's a wonderful model, and it's exciting to truly see the benefits and the successes that are happening. And there's a place for everyone at the table of the model, and that's what's wonderful about it. It's truly a collaboration of everybody working together.
Great. So can you maybe touch on some of the key components that have made certain programs so successful, and kind of what are the necessary steps that schools should take in implementing coordinated school health programming so that they are successful?
Yes. The success is definitely the support of the administrator, the director of schools, and we have some amazing director of schools. I am in awe of them across the state of Tennessee. We have some brilliant director of schools, brilliant principals, that we just need them to continue to see the vision of the whole child. And that's what we're teaching here. We're talking about the whole child, and support their coordinator, and teachers stay on those healthy school teams and really help with the sustainability, and truly everybody working together.
Great. So do you feel that schools currently provide children with the opportunity to live a healthy life, and maybe discuss the role of policy in providing schools with the tools to do so?
It's working with your coordinator. It's working with the coordinator to develop the policies that's needed to make kids healthier. This is just the start. Coordinated school health has only been up and running since 2007, and research shows that it takes 5 to 7 years to truly see systems change. So we're just babies in this. We're just starting in this. So the policy change in a school system, if they can all work together and dream it, they can make it happen. We have a wonderful partnership that we've just formed this year with the Tennessee School Board Association, and that's been invaluable. So again, it's as far as policies. It's just everybody working together with the child at the center.
What would you say is the biggest misconception about coordinated school health?
That we do it all, and that the coordinator should get all the credit for everything, and coordinated school health should get all the credit for everything. Absolutely not. I think it is imperative that everybody know that this would not work. Coordinated school health would not be successful without everybody at the table, everybody coming together. That's where I have the utmost respect for people at the state level in school nutrition, for the Department of Health, for all of our partners, and it's that way in a school district as well. Is that we have the utmost respect for school counselors, for physical education teachers, for nutrition supervisors. My goodness, they all love their students so very much. And again, it's all the coordinator does is just coordinate all those people, and it takes everybody working together, and their role is invaluable and important, because if they weren't in their jobs, then the coordinator wouldn't be able to do theirs.
So what is the role of teachers in helping to model healthy behavior for students? And maybe can you provide some suggestions for teachers on how they can be a healthy role model?
Well, first of all, it's the obvious. That's where teachers, you are so valued in the coordinated school health model, because remember, one of those 8 components is healthy staff and wellness. So the first part, how teachers can help, is the obvious. And if we're saying that healthy children do better academically, guess what about healthy teachers? Healthy teachers are better teachers. And teachers are under stress, and they're under the same type of stress that children are, just at a obviously a different level. But staff wellness is equally as important in a school. So being a positive role model, and a teacher drinking his or her water, working on eating fresh fruits and vegetables, and not drinking sodas and candy bars and potato chips, that's the first and foremost thing that they can do. The second thing they can do is finding ways to integrate physical activity, health education in with their core lessons, and it can be done very, very easy, and it's fun. What's important is that health education, nutrition, physical activity, again, is not a burden on anyone, and finding ways, again, to integrate those topics into subjects. That's brain-based teaching. And also finding ways for kids to get outside and walk, and you'll find that they do better academically, and they won't be so squirrely wiggling in their chairs, and it's a benefit for everyone. Adults can't sit still all day long, and we can't expect kids to either. So those are the two very simple ways. And I know it can be done, because we see it every single day, and I did it in my own classroom.
Great. So you just discussed this connection between health and academic achievement and performance, but I know a lot of teachers are concerned with really having their students perform well on tests, and that is how they're evaluated. So a lot are kind of afraid to step out of the box and incorporate nutrition and physical activity into the classroom, because they fear that it will take away from the time that they have to spend on these lessons. Can you maybe discuss ways that teachers can utilize physical activity and nutrition as a way to kind of help their children perform better.
Yes, that's where it needs to be integrated, and that's where it's easy to put a math problem up and then tell kids do how many jumping jacks, is the answer to the math problem. And I agree. I mean, we don't need to add anything to a teacher's academic day that causes them any more stress. We have the ultimate respect for teachers, and it's finding ways that it's not any more work on them, not a burden on them. And like I said, it's as simple as getting up and just doing jumping jacks. There are curriculums out there. Take 10, Organ-Wise, different curriculums that make it very easy for a teacher to integrate core academics and physical activity. Again, integrating nutrition, in a math lesson, you integrate, how much does it cost to if you're on a budget, how much does it cost to go to the grocery store and buy healthy foods. So it's about integration, and again, it's providing relevancy. You are teaching them relevant skills that they can use throughout their life.
Great. So are there any other important concepts about coordinated school health that you would like to share with us today?
I've been involved with coordinated school health for a really, really long time, and it's something that I believe in because I see it happening, and it truly is a wonderful, wonderful model. And again, I'm just very proud to be from the state of Tennessee, and being proud of the coordinated school health initiative. And I just thank everybody for the work that they're doing, and the partnerships. And again, please just get plugged in with your coordinator and find out how you can help.
Great. Well, thank you so much for joining us today.
Thank you.
Thank you for joining us for this presentation of the Vanderbilt Online Guide to Children's Health of the Vanderbilt Children's Health Improvement and Prevention Department for the Monroe Carroll Jr. Children's Hospital at Vanderbilt.